It is one of the most popular of all plastic surgeries, so most of you probably think that having a nose job is no big deal. Well, think again. The truth is, botched nose jobs happen all the time, but they don't have to happen to you. Please welcome Dr. Thomas Romo, a board-certified plastic surgeon and director of facial, plastic, and reconstruction surgery at Lenox Hill Hospital, big plug, here in New York, and Andrea Perry, who has had to have not one, not two, but 4 nose jobs. Andrea, I'm going to get to you in a minute with these 4 nose jobs here. But, doctor, let's start with you. What should people know if they want to have rhinoplasty or a nose job?
Well, nose job surgery is an elective cosmetic procedure. And
you don't do it because you have to. You do it because you want to.
Absolutely. But the problem is that the nose has a physiological function. It's the filter of the body. It's also the humidifier of the airway. So it's important to know that the physician who operates on you can handle the internal aspect of the nose and not compromise the nose because of cosmesis. We always say, don't sacrifice function for cosmesis.
Okay.
You know, none of us, I think, on this program have had our noses done, although I have to tell you, there have been times when I've thought about it. But I remember when I was younger that it seemed to me all my friends were having it. Now, today, what is the youngest age that a young person should have their nose done?
Teenagers are where we start, and we want the teenager to have usually had their growth spurt. So in girls, that'll be 15 to 16, and males, maybe 18 to 21.
So you shouldn't do it before that when the parent of the child says, I really want to get my nose done.
Because the platform's changing. Their face is growing, and you may have some change in the shape of the nose as it matures.
Okay, Andrea is currently a patient of yours, and she had 4. Am I right, Andrea? 4 nose jobs. You must tell us what happened to you to get you under the knife 4 times.
Well, Star, it was a nightmare. I certainly didn't want, when I set out to do this, to have 4 separate surgeries. The first one I had years ago, I'd moved to New York, wanted to model, was rejected by agencies because they felt my nose was not photogenic. So I went and had an operation. Didn't turn out very well. Went a year later back.
What was wrong with it?
It wasn't narrow enough. Initially, I had a deviated septum, and the tip was very high. Wasn't very photogenic. So couldn't get it narrow enough, went back a second time. This time the result was not very pleasing. It just didn't look good. At this point, I wasn't going to pursue modeling anymore. I just let it go. I was very disappointed, but I just let it go because I felt this is not going to work. Years later, finally, had my 3rd surgery because I wanted to just fix this. I felt operated on. I felt sort of disfigured looking. I wanted to straighten it out and just be natural and forget about it. That was a surgery that really went haywire. Ended up, yes, not looking or feeling at all my best. And then I found Dr. Romo, and he straightened me out, so to speak.
Well, it's a great nose now, but I got to tell you, I didn't think your original nose was that bad. So what did you do to bring about this now almost perfection?
Well, we always say there is no perfection in plastic surgery. There's improvement, and luckily the 3 prior nose jobs she had were not for me. I actually saw Andrea after she had 3 prior nose jobs, and she presented with the problem that we normally see when there's been a multi-operated on nose, and that multiple cartilages and bones had been taken away, and then the nose scarred down to an irregular shape.
Yeah, so we see people sometimes with little teeny-weeny noses.
Almost squished into your face.
Absolutely, and that was the concept of beauty of the years ago, where today the concepts of beauty are larger, and ethnicity is in, and natural is in. That was an older concept of beauty. But what we did with Andrea, and I think we had some pictures about the way we handled this, what we did is this is actually the operative procedure, and what we did is we actually put some packs in her nose to prevent the nose from bleeding during the time of surgery. And then what we did is we took some marking pins, and you can actually see that on one side, the nose is actually collapsed in. So she had this anatomic and cosmetic distortion, as well as an inability to breathe. And so what we ended up doing is the approach that we tend to use on these noses. It's called an open approach or an external rhinoplasty approach. And you actually peel back the skin, expose the underlying architecture, and then you take the nose, the septum, and rebuild the nose back.
You know, I know people at home are saying, what questions do I ask my daughter, my 17-year-old, wants to get her nose done? So give us some of those basic questions.
Well, I think you need to make sure that the doctor that you're utilizing is a board-certified physician in what he does, that he has extensive experience in the surgery that he uses, and also be able to talk to some of the patients that who had undergone the surgery.
This is very good advice, and we've heard this kind of advice before with any kind of elective surgery, and that is check on the doctor. And Andrea, you are nodding your head because you obviously didn't do that.
Oh, no, I just went with the first person who was recommended to me, and I did no research.
Well, fortunately, you look beautiful, and doctor, thank you for this advice, because there are a lot of young people on summer vacations, too, who want to get their noses done. It seems to be a good time. We thank you, and we want to tell you that if you want more information, log on to our website, and you'll hear more. And when we come back, one of the funniest women we know, and we really do know, gets a turn on Joy's Comedy Corner. Stay with us.
Last Dance.